I think the questions that people who currently use the private health sector have is if they do use the public health sector under the NHI, and it would be an integrated sector, right? So how long would the waiting times be? Would they have to take off half a day from work to, for instance, get their children vaccinated? Or would they be able to use the system for everything or just some things? For instance, would you go to get your children vaccinated for free, but when you have a gynecological problem, would you go to the private sector? They also have questions about medical insurance, or medical aid as we call it, because it's likely, it hasn't been announced exactly what would happen, but one of the strong options that's a strong contender is to pay for the national health insurance would be a salary deduction. So a certain percentage of your salary, depending on what you earn, would go towards the NHI. And that amount is likely to be a sizable amount, comparable to what you pay for a medical aid today. So it would mean that there would be quite a large sector of the current medical aid population who wouldn't be able to afford both payments, because you would then have to pay twice if you also want medical aid. And that would have an impact on the medical scheme industry, because there would be fewer contributions of particularly healthy people that could sustain all the payments. So it might mean that the medical scheme industry change, that it sort of becomes a top-up service, that you don't have medical insurance for everything that you need, but maybe if you need a heart transplant or if you need something that the NHI wouldn't offer you, you would join that service. But it might become more expensive because there will be a smaller pool of people to contribute to the fund that's going to be used.
It seems as though very difficult conversations certainly need to take place between both the private sector as well as the government. From your perspective, are we seeing sufficient levels of engagement, or is it concerning because there are potential businesses here that might not exist in 10, 30 years' time?
I think when the white paper came out last year in December, one of the very controversial issues in that paper was that it gave the impression that medical aids would become illegal in the country once the NHI was there, and that you wouldn't be allowed to join a medical aid. The minister since then intervened and said, no, that is not how it will work. But I think because of the freedoms that the private health industry in this country have enjoyed for very long. For instance, there is no regulation as to how much you can ask if you're a private doctor, how much you're allowed to ask to charge a patient. Because of those freedoms, it's going to be hard to have rules imposed on private health professionals. In terms of price structures, I'm not sure how open the private health industry is to negotiating for cheaper prices to be part of the NHI. They used to do a larger income, but as Dr. Motsoaledi pointed out, they also pay very heavy fees on insurance that they may not have to pay for the NHI if the government covers that part of it.